National board exams are tests that are taken by all chiropractic students across the country, and they're divided into 4 parts. Students take the first part when they're about a year and a half into their education, and they're taken on the same day across the country at different chiropractic colleges. The first part covers essentially basic sciences. It has 6 parts. Each part is a 90-minute long, 110 multiple choice question format. Students take them over a weekend. And part 2 is laid out the same way. It's 6 separate pieces that are taken over a day and a half. Part 2 tends to focus more on the clinical subjects as students are getting into their 3rd year and so on. Part 3 is a more clinically integrated test. It's still a written test, but at this point students are expected to pull information together and come up with more of a broad clinical picture of what a person is presenting when they come. And then Part 4, which students take near the end of their education, is a practical exam. And it's done with trained patients. It's done with various stations, where a student will go to a station, there'll be a patient there, maybe an x-ray or an MRI, perhaps some paperwork with some lab findings or some other test results, and then there'll be a series of questions that the student asks, and they have to interact with the patient, so they'll have to ask questions of the patient, and then they're graded on how they put the whole package together and come up with the answer. So the idea is that after these 4 exams are taken, that a student has graduated from a program and passed these exams, that they essentially are ready to enter practice. And all 50 states in the U.S. accept the national, or they require the national board exams be passed before someone can apply from licensure. Virtually all the states in the United States accept national board exams as all the testing that's required. There are a couple of states that have their own tests, usually related to, let's say, jurisprudence, local laws, regulations that apply to that state. But in the main, national board exams are something taken by all chiropractic students in the United States, and they essentially certify that the student is ready to go into practice.